All right. Hey, guys. I'm Dr. Chris coming to you live today on this Zoom call to give parents another opportunity to get the information that you're looking for. The reason that we're doing this is because a lot of parents have told us that they've been unable to get to one of our live workshops to get the information that we share. And because of that, we wanted to offer this as another route to help people, to help them, because a lot of parents want this information and it's really hard for some of them to get it during the week. So you may have missed us before, you couldn't make it in the past, or you just really want to help your child and help your family. And here's the thing, you just don't know how, right? So if you know what to do and you know how to help your child, are you going to take the necessary steps to do that? I think that has been the biggest issue that with parents regarding the health of their children is that every parent wants what? They want more information. Every parent wants to help their child. Every parent wants their children to be healthy. But the minute that we give the parents the opportunity to do just that, it becomes a different story. So all of the information that I will share with you today, it's going to be great. The minute that it goes from great to life-changing is what you're able to do with that. It's decisions that you make with it. So if you decide to move forward for your child, to move forward for your family, you're helping them to a higher level of function, a higher level of health, and a higher level of possibility. If you let this information go into your brain, sit there, stay put with no action to it, the information becomes useless. So for those that are still joining us, I'm trying to stall as much as I can to let people jump on the call with us. So if you're joining us today, we're going to talk about something that we hear a lot about with kiddos, and especially in the young children early on during school, but it goes all the way up into our teen years as well. ADHD. Now, there are different classifications, different requirements that are needed to get an official diagnosis, but it doesn't matter because the symptoms are very similar. Knowing the symptoms, understanding them, and then classifying them is one way, but the truth lies in this. How are we able to help them? And so what is the action that we can take today to set up better health and better function for happier kiddos tomorrow? Newest studies show that 1 in 7 children are diagnosed with ADHD. And many teachers have actually told us that around 1/4 of their classroom, sometimes even more, of their students are taking some form of medication for their ADHD. And that's like your Ritalin and your Adderall medications, so that they can sit still and concentrate throughout their day. I'm here to tell you this. ADHD is so misunderstood. Many people think that if you have ADHD, it's a problem. We like to view it as ADHD is a superhero power because it is a condition that, one, is very easy to understand, but once we understand the cause of ADHD, we understand that the symptoms that we are seeing are simply the effects of that cause. So I'm going to describe ADHD in a way to help people understand what it looks like and how we are able to view ADHD. ADHD is like a race car. So when you have ADHD, you like to drive your race car fast, right? Your race car is representing the pace of your brain, how your brain works. So in order to drive your race car, your brain fast, you must be hitting the what? You must be hitting that gas pedal, right? So if you want to maintain these fast speeds, your foot becomes stuck to that gas pedal. So now this is why we call it the superhero power, because a lot of our famous inventors, artists, innovators, CEOs, at some point in time in their life, they have been described as having ADHD or something similar to ADHD. So here's the thing. If you were to ever look at a super fast car, like let's use a Ferrari, for instance, a race car, you will notice what on that Ferrari or that super fast car? You notice a souped up large engine, right? That's that superpower. That's the ADHD kid's fast brain. But what we don't notice on them most of the time is that they have a very sophisticated braking and handling system. The reason being is that if you have a race car, a Ferrari, you are going to need to have that sophisticated system to handle tight turns, tight corners, and you will need a quick, efficient braking system to handle that. When talking about a child with ADHD, they have that really fast engine, that fast brain, but they have small brakes and an inefficient handling system. So driving that Ferrari car, it's like having brakes that are meant to be on a bicycle. It doesn't match up. So when they're in the classroom and they're required to sit still, pay attention, or focus, they're in a slow moving environment, it becomes very difficult. Their fast brain has a hard time pumping those brakes with their foot when the other foot is stuck on that gas pedal. In other words, the coordination and the regulation of their nervous system is very inefficient. So what is the common approach to help these kids? For most kids, they receive what? A class 2 controlled substance, which it's in the same category as cocaine, to control the expression of that fast brain, that super fast engine car, which is known as what? The symptoms of ADHD. What do these types of drugs actually do to these kiddos? So just like cocaine, it can stunt and impair their normal brain development, stunt and impair the normal brain growth, and it can cause unwanted side effects, and that is including death. Even though this has been a very common approach to help these kids, giving them controlled substances for like the last 50 or 60 years, there is yet to be any studies that are comparing the benefits and the risks of taking them. So the true question comes down to this. How can we help kids with ADHD improve that braking system so that they can navigate those turns and those corners efficiently so there is a better balance in that fast brain? How can we help them cope with school, with stress, and the ever-changing demands of life? Is the route of addictive, stimulant, and psychoactive prescription drugs the only option? The answer is, heck no, drugs are not the only option for these kids. Many parents who do not want to go down this route don't really understand other options, and that the other options includes what we do for kids, which is chiropractic care. So as a pediatric and family-focused chiropractor, much of my practice is kiddos, and a large percentage of the kids that we are seeing are commonly expressing ADHD-like symptoms, or they've received a diagnosis, an official diagnosis of ADHD. So knowing the true cause behind that from a neurological aspect becomes very important when we care for your kids. ADHD is a neurological disorder caused by a dysfunction in the nervous system. Within your nervous system, we actually have two modes of operation. We have what we call in our office the gas pedal mode. This is your fight or flight stress response. It's our sympathetic nervous system. Our stress response is responsible for that, surviving. The system, it usually kicks on when we are in danger, when we are scared, when we are frightened. And it's supposed to turn on when we need it, which is the whole point of it is to keep us alive and to keep us safe from outside threats. But it is meant to turn back off when we escape that danger and we get away from those threats. Then we have the brake pedal. This brake pedal mode is the rest, the digesting, the healing side of the other side of that nervous system. It's our parasympathetic nervous system. So this is the side where your growth and your development phases come in. In both of these systems together, they make up the autonomic nervous system. Many children who are diagnosed or suspected to have ADHD, they're actually stuck on that gas pedal mode. So it's slowing down. Slowing down for these kids is not really an option, so that they begin missing out on those growth and those developmental phases because of the inefficient braking system. So does that make sense to you guys? So the question is, how does this happen? So in our practice, we are trained to look at the very beginning of where this stress could have started or where it began. Typically, in our experience, what we have found that it goes back all the way to the birth process. So I'm going to give you a little bit of an example to show you what we see in our practice and the common associations with that. The birth process. This is an amazing part of the female body, of how it is its ability to create a human life and then deliver that human life into this world. Many times the birth process, it can be very tough on the child, especially when we add in our cesarean sections or stressful births with vacuum extractions or forceps delivery. And the reason I'm bringing this up is because this is something that has been very common in our society today, and the numbers of children who are born in hospitals with these interventions are increasing every single year. As again, association with that, each year more kids are being diagnosed with ADHD and other issues as well. So what we want to point out is this: the pulling and the twisting forces that are done on a child's head when they are being born and utilizing these types of interventions, it can easily create a misalignment and an interference stress response in the upper cervical spine, especially on that first vertebra that's in our neck. We call it the C1. It's the atlas bone, so it's the first bone in your neck. Because of the amount of torque and tension and pull that's being forced on a child's head when they're being born. So this C1 atlas bone, the top bone in our neck, it sits right next to what we call the parasympathetic driver of that brake pedal mode system. So that nerve that is located upper cervical spine right next to that first bone, it's called the vagus nerve. And this nerve is solely responsible for the braking system in our body. So if there is a misalignment or an interference located in that specific region of your body, it will shut down those brakes, keeping your child's foot stuck on that gas pedal. Without removing that stress, you cannot overwhelm the gas pedal with your foot completely stuck on. That is the issue that we see in the association that we see a lot of times in these kids. So what you're thinking is, how is ADHD and chiropractic related? Our team of doctors utilize very gentle and very specific chiropractic pediatric adjustments to help reduce that stress and that interference that is up top in the upper cervical part of your spine, in the upper part of your neck. And so taking pressure off that C1, that atlas bone, it restores proper motion and structure and function at that area. So better function at this specific area, it helps to improve that brake pedal driver, that vagus nerve, which takes the child's foot off that gas pedal more often. So it's not stuck any longer. It's very simple. So when we are able to do that, we can then create better adaptability, better efficiency to go through those turns and braking when we're needing it. So even though chiropractic care does not treat the ADHD condition, we are actually focused on allowing your child's body to function appropriately so that your child can have that normal and symptom-free life that, as every parent, we're looking for and striving for our kids. One example I want to give is at our last workshop, we actually had a parent come in who was telling us that she had a child who had ADHD, and they've been struggling for years with that child, whether at home or in school or in other social situations. And she came to us to our workshop to learn more about how to help her child. When it came down to it, we actually asked her, like, what is it specifically that you're looking for? She said, more information, because we've been seeing a chiropractor for my entire family. And yet we are still searching for more answers because we are not getting the help that we actually need. And so this mom, she's doing all the right things, but sometimes we have to understand a few things. As a chiropractor, it is very easy to understand the biomechanics of anatomy and how the body is working. But in knowing how to adjust a person, of course, some chiropractors have training to adjust the pediatric population. But the determining factor is this: knowing how to adjust is great, but it lies in knowing when and why to adjust for these kiddos in the specific regions. So just like any medical doctor, all physicians, they practice differently and they practice with different techniques. And the same goes for chiropractors as well. What makes our office so much different is not only our experience with kiddos, but the specific training that we have on a weekly basis with our advanced neurological technology that measures the child's gas and their brake pedal, so the function of their nervous system. So without a doubt, we know exactly how to measure your child's nervous system and then coordinate a plan based on what they actually need to get them to function better, to get that stress that is stuck on that gas pedal, to get that foot off that gas pedal as much as possible and put them into that off that gas pedal stress stuck on mode into that healing, adapting, and thriving mode of life, that parasympathetic nervous system. This is the key difference that makes us stand out. And we don't have any other colleagues in our area that actually does this the way that we actually do it. So The next step I want to talk about is the scan. So we have 3 different types of scans in our part of our technology that helps us to understand what it is that's going on inside of our child's body. Our first one, and I actually got them over here to show you guys because I want to show you that they're very safe and very, very effective. And we're not putting anything in the body. We're not taking anything out of the body. So it's nothing scary that we're doing. And it only takes a few minutes to run the scans. But the first one that we use is the rolling thermal. So very simple. You can see what the technology looks like. Nothing scary. You can see a couple little sensors here. Your rolling thermal is the part of the technology that uses infrared measurements. And what it's reading is it's measuring temperature. Temperature is a clear and accurate tool to determine neurological stress and neurological tension that is being built up on your child's body. The next one that we use is called the surface EMG. So this technology stands for electromyography. This scan actually helps to determine the electrical impulses that your body is sending to your brain. So the reason being is that understanding the results of this scan can tell us if your child is suffering with ADHD or something very similar, how much energy is being used in the muscles surrounding their brain that their brain is actually sending out to their body. Because if their brain has too much energy, it's going to send that out to the muscles to understand what's going on in your child's environment. More information into the brain, that fast engine, that fast brain, that's how it's working. So because they're doing that, it's the brain doesn't make sense of that information, so it needs more. So in other words, too much energy means too much stress is stuck on that gas pedal. It also helps us to tell us the quality of that information. So is it coordinated? Is it controlled? Is it symmetrical? And is it balanced? Because if it's side to side, we're supposed to be balanced side to side, right? Just like temperature should be the same on either side, and all of them should be within a normal range. If not, it tells us where that imbalance is and where that dysfunction is. The next one, this one's a little bit bigger, but very easy to see here. You got a couple of probes right here. This one is our heart rate variability. So this is a very important part of your scan because this one is actually telling us how deep-rooted is your child's nervous system on that sympathetic, that gas pedal side. So how often and inefficient are we with that nervous system? So if your child is stuck on that gas pedal, how is it affecting their overall health? And so when it comes to adaptability and efficiency, when they should be activating that healing, growing, learning, and developing side, especially in the early years. So let's take a look at these scans. So I printed off some scans just to put them together to give you an idea of what it looks like because you're unable to make one of our live workshops. The reason I printed these off is because in our workshops, we actually show you some scans. We give you some examples of what it looks like in kids that we've seen and kind of relate it back to how it looks in your life and what you're looking from a perspective as a parent. So when we run these scans, it gives us results and it puts the children on a plot of how their nervous system is functioning. So from those 3 scans, we have 3 test results. So the first one, the top one there is our heart rate variability. And so the goal is to be anywhere in the green box. And then for kiddos, they're supposed to be a little bit higher functioning because they're developing so fast and they're learning new skills every single day. So that's our HRV. The next one is an example of a SEMG. That's the amount of energy that the brain is sending out to the body. So it should be, as you can tell, it should be white within normal range. It should be balanced, coordinated, and symmetrical side to side. And the last one is the rolling thermal. Rolling thermal is measuring the temperatures from side to side. Again, they should be balanced. They should be even. They should be within normal ranges. And so there's another example of a normal scan there within normal ranges, all those whites. When we see whites, we think white is good. Anything outside of that gives us colors. So I want to give you an example of some kids in our practice, just like we would do with a live workshop. It's a little bit difficult to do it here, but I'm still going to do my best for you. So here's a patient, a 6-year-old diagnosed with ADHD. They also had behavior issues. They were aggressive and impulsive. They had focus and memory difficulty as expected with a child who's going through something like ADHD. They also had difficulty sleeping. So after 3 months, they had better focus, better schoolwork, no bad reports from school. They were calmer. They had better emotions, coordinated, better adaptability, and just overall happier. So I want you to see their scans here. So this is the beginning, the first scan that they got with us. This is an SEMG, and this is a rolling thermal. As you can tell, lots of colors on the SEMG, meaning lots of energy that the brain is sending out to the body. So we were able to measure that. And then we were able to measure the temperature from side to side. And I want you to take a look at, that was a big jump at the upper cervical spine, right next to that vagus nerve, that parasympathetic driver. So huge interference there, not allowing that child's foot to be on the brake pedal, but it was stuck on that gas pedal. So after 3 months, can you tell a difference here? Lots less energy coming out from the brain, better coordination and better balance of that autonomic nervous system through and through. So huge changes there. So what did we do with this child? All we did was improve the efficiency of the nervous system. We've removed that stress in the upper cervical part of their spine, also in the lower sacral region, because those two areas are the main regions for the parasympathetic nervous system. And then we allowed their body to adapt, heal, and thrive. So very simple, very easy, but without knowing the scans and without knowing how to help them, that's how we were able to do that, knowing what to do, knowing when to do it, and how to formulate a great plan for them. Another child that we have, this is a 9-year-old who, again, ADHD, sensory issues, they had focus and attention issues, high energy, and very emotionally unstable. So after 5 months, the parents reported better sleep, better school focus and attention, better emotions, articulations of words and speech was immensely improved, less sensory complaints of food textures and clothing textures. Again, sensory processing and ADHD kind of go hand in hand because, again, it's a neurological dysfunction of the nervous system. And then also less overwhelming energy reported from the parents. So all in all, awesome reports from them, but I want you to see their scans. So this one has the HRV on there. So if you can tell that this side on the right here, we have HRV, and again, another rolling thermal. So HRV, if you can see that white dot, that was this child's first scan. That's where they were. Down here, it says sympathetic nervous system and parasympathetic nervous system. So it puts us on a plot of how efficient is our nervous system and which side are we? Are we stuck on that gas pedal, or are we on that healing, thriving, digesting, growing, developmental side? Here, she's on the sympathetic side. So very stressed out, foot on the gas pedal, not doing a whole lot, activating that parasympathetic side where we should be when we're kids. So after 5 months, it's hard to see, but that white dot there shows her last scan, which is right in the green box. It's still not perfect, but it's within normal range. It's in that range of good, healthy function, better adaptability, and better efficiency, which is taking our foot off the gas pedal and are putting our foot on the brake pedal more often and more frequently. And again, rolling thermal, I think you can see the upper cervical stress here. Sorry, I got a message from Zoom. There we go. Yeah, so upper cervical stress here and a lot of torque and tension just in general on the body. And now we look here, we still have some stress that we're working out, but totally different. So taking that foot off the gas pedal becomes very important in these kids and helping them to adapt to their environment, helping them to function better. So it takes some time, it takes some energy, but that's the difference that we can make. And these kids are so much happier and they're doing so much better, not only at home, but in school as well, and in social situations when their parents were just so stressed out and hard on themselves because they felt that it was their fault. It's not their fault. It's just an inefficient handling system, inefficient braking system that we had to reboot and kick on so that we could develop better healthy function from overall. So hopefully that helped to give you an understanding of what it is that we're looking at, what it is that we're doing with these kids. So if you were wondering how your child's nervous system is working, or if you've been thinking about your child's diagnosis of ADHD, or even suspecting that there's an underlying reason that for your child's symptoms that may resemble something like ADHD, please give our team a call. Contact New Hope Chiropractic. We can help. We've seen the difference that we can make on a child's life to take them from that stressed out, gas pedal stuck on at home and in the classroom that's not allowing your child to grow, to develop their brain and nervous system well, to less overwhelm, better function, better reports from school, better growth, and better development. It all lies within locating the cause of all that interference and stress, reducing that cause and allowing the body to properly heal, to work appropriately, and then to function efficiently. So we would absolutely love to help your family, to help your child so that you guys can have a better life. Is there anyone on here who has a specific question? I did not do a good job of watching the chat box there. I didn't see any questions come in. Does anybody have any questions? And I know we have a few people on the call today, so you're more than welcome to throw up your hand if you have a question, or put it in the chat box. We'd love to answer them for you. And this is giving you a chance to ask a doctor, ask our team what it is that's a question that's weighing on your mind, any way that we can help you. Are adjustments safe for kids? Yes, great question, Miss Marie. Adjustments are very safe for kids. So just like I said before, different techniques for different doctors. We have specific techniques that we utilize to adjust kids from all ages. The earliest adjustment that I've ever given to a child was it was my own son when he was about 40 minutes old. And the reason being is because he was born in the best available option that we had, opportunity, and he still had some issues. He had a cord around his neck twice and around his shoulder once. So a little bit of stress coming into this world, and it wasn't allowing him to turn his head, to breastfeed on his mama. So we adjusted him there, and immediately we saw increased cervical rotation left and right, and then he was nursing like a champ. And if you've ever seen a picture of our child, you will know that he is healthy because he has no issues with breastfeeding. So yes, adjustments are very safe, and you're very welcome. And we use a lot of different techniques. So different kids need different types of adjustments and different approaches to care. Some kids who are very overwhelmed already and very sensitive and have that sensory issues, which are very commonly associated with kids with ADHD, it's a very tonal and very soft approach to care. And less is actually more with these kids. We do less with these kids in the early stages of care, because if we were to overstimulate these kids, which is why we hear a lot of stories of other chiropractors who overstimulate these kids who are already overstimulated, and then they see negative results and they get feedback from parents that chiropractic doesn't work for my kids, or chiropractic is not good for my kids. And that's the reason, is because we don't want to overstimulate a system that's already overstimulated. So knowing the scans and knowing what's going on inside your child's body becomes very, very important for us for the care for your kids. So Ms. Sean said, I don't think my kid will lay still on the table for an adjustment. That's very, very common in our practice. We see lots of kids under the age of 5. And so it's really hard for kids to sit still just in general, because they're learning in their environment, and moving around is very key for developing everything in their body. So a lot of kids don't always get adjusted on the table. We don't need them to be adjusted on the table. We can do it in the playroom. We can do it as they run around the office. Very, very versatile in our practice, because our doctors are very mobile anyways. So our adjustments are very quick and very easy and very efficient, and we have tools and ways that we can do that. So yeah, laying still for a child who has ADHD, I can understand. And that's why we're able to get these kids adjusted and get these kids great care even when they are not on the table. So great question there as well. Thank you. Hopefully I answered these questions for you guys as best as I can. If I didn't, just let me know and I'll try and give you a better explanation on that. Any more questions? I'll give you guys a couple minutes to jump on and throw in a question. If you are having trouble with the chat box, just press the button. I think you can do it. Press the button and it says raise your hand. It'll show me that your hand is raised, and I'll try and unmute you so you can ask a question through the audio there. I'll give it a couple more seconds. If we have no more questions, I'm just going to move on and end this webinar for you guys. So hopefully you're able to get some great information and get an understanding of what may be going on with your child and how we can help you guys. So with all of that said, what we are doing and what we do at our live workshops is we offer parents an opportunity for the next couple of weeks to have your child's nervous system looked at, have it checked for disturbances and interference with our advanced technology to get a clear picture of what it looks like inside the body. So when you can understand what your child is going through, you can understand how you can best help them, and it's a way that you can give your child the best chance at life. So we offer our VIP discount for anybody who calls in the next couple of weeks and mentions the ADHD webinar that you were on. You'll go through an entire consultation, our examination with the technology, and then we will sit down with you and give you a report of how we think, what it looks like in your child's body, and how we know how we can help you guys. Because this could be the difference that you're looking for your child, and we don't want you to go through yet another year with your child struggling, whether it's in school, with friends, with sports, with growing and developing, with learning to read and write. All of those things are so important, especially in the younger years. And so this opportunity could be the difference in taking your child's life of struggling and hardship to thriving and better development and better growth just in general. And so if you are tired of that struggle, if you are tired and you want the answers to what's going on with your child, this is your chance. And this is what we do every single day, is helping kids who are just like yours function better, feel better, and just be better. So